So we got the appliance in. So the appliance is in, guys. And here's our patient, our happy patient that's gonna get her expansion done. The appliance comes in a plastic bag. Make sure that when you're opening the plastic bag, you don't distort the appliance. Just treat it like it's very, very delicate, because it is. So if you are too rough getting the appliance out of the plastic bag, you can literally distort the bands. You literally just want to treat it gently, and there it is. So now that the appliance is in, the first thing that we're gonna do is we're gonna remove the patient's steps. So pretend steps, remove, all right? And the space should be made so it was easy to remove those steps. The first thing that you're gonna do is you're gonna try on the appliance on the patient. Let's try this on and see if it fits. Oh, look, a perfect fit. It's a perfect fit because we fit the bands last time and we took the impression, and the lab made a perfect appliance. So step one, fit the appliance, take off the steps, and fit the appliance. Make sure that it fits. Now we're gonna go ahead and remove it with our band remover. So let's go ahead and gently remove the appliance, and it comes out. Put it to the side. We're gonna make sure that the patient's teeth are nice and dry. So we'll grab our handy dandy air water, have the patient open. It's nice and dry. Stay open, honey, stay open. For this appointment, we also wanna have plenty of cotton rolls, and we also wanna have some 2x2s as well, all right? All right, now we're gonna go ahead, and the patient's molars are dry. We have them open. We're gonna go ahead and quickly mix the cement. Now, if you're using old school, it's literally 1 scoop of powder to 1 drop of glass ionomer. But I love pre-made mixing cement. And thankfully we use Fuji in all of our offices. So we literally remove the cap. And so then what we're gonna do is we're gonna go ahead and we're going to put the scoops. Here's our appliance right here. Put the scoops. So per band, I typically do two presses per band. So in total, this would be 4 presses, but I'm literally just gonna show you guys with a band that we have that's kind of like, was on the side, messed up for show. Cause this is actually our display RPE. So anyways, when I mix, and then let me just show you guys real quick on an empty one. So when you mix, you're literally gonna take both, which is the same amount, and you're literally going to just mix them around, join them together, collect it, mix it around, collect it, kind of like alginate. Collect it, and once it's an even blue color, then at that point you start putting it on the bands. And the reason why I'm showing you without it here is because it sets fast. So you only have a limited amount of time. Now watch this. Okay. This is how much glue you kind of want in each band. And now that we have the glue on the bands, we can actually put it in the patient's mouth. All right, stay still, honey, stay still. And make sure that we get it in with our band pusher. Make sure that it's seated, fully seated on both sides, distally and medially. And then wipe off the excess glue everywhere. Wipe off the excess glue anyway. And now go ahead and bite down on these 2 cotton rolls. While they're biting down on those 2 cotton rolls, at this point, we're cleaning up because we don't want our cement to set on our spatula. It sets fast, guys, so you gotta make sure. So make pretend I don't have my suctions on, okay? I literally just wet this paper and I'm literally cleaning up all my instruments. And now it's clean, but it was setting. It was literally setting. And what else did I use? I used my band pusher. Clean that. Make sure that it's nice and clean. If you use your bite stick, make sure that it's nice and clean. And you can just put everything to the side. All right. And now we're going to clean up our patient. So I grab a 2x2 with my scaler, have the patient open. All right, grab these 2 cotton rolls. At this point, the cement is literally basically dry. And I'm going to clean it off of the occlusal. So tilt your head, tilt forward so that you can see my little camera. Okay. Sometimes it gets on other teeth because it's literally messy, so you gotta clean it off, the adjacent teeth off of the gingival, and off of the gingival here. And if, of course, if anything is on the appliance, then you also want to clean it off. All right, perfect. Now, go ahead and bite down. And at this point, I'm explaining to the parent what's gonna happen. So this is a rapid palatal expander, okay? And so listen to these instructions so that you know. You're gonna turn it 1 time every day for as many times as the doctor tells you. So at this point, if Dr. Yarbrough's right next, the doctor is right next to us, then we can go ahead and we can let him check the patient and let us know how many turns they're gonna do. If Dr. Yarbrough is still, oh my God, if the doctor still is a ways off, then we can start showing the patient how to do the turns. So let me get the key so I can show you. So, the doctor has come, and then open up, honey. Everything looks good. It looks like this patient's gonna need 12 turns of expansion until your next visit. So please go ahead and turn it 12 times and we'll see the patient in 2 to 3 weeks. All right, perfect. And the doctor has left. Now at this point, we're going to show the parent how to do the turns. So you basically are gonna do 1 turn a day for the next 12 days. Then you'll stop. We'll see you in 2 to 3 weeks and check how the expansion did, okay? I typically like to do the turns at night because it helps the patient sleep through the pressure. So I would do it 1 time every night, and that's what I recommend. But of course, it is what is convenient for you. So if during the day is more convenient for you because of your schedule, then you can go ahead and do that and it's fine. I just recommend the night because they sleep through the pressure and it's more comfortable for the patient. Now, the way that you're gonna do the turns is, you see this little hole right here? You're gonna put the key inside the hole, just like this, and you're gonna turn it backwards until you see the very next hole, okay? Then you're gonna pull back and take it out. If you pull it back and then come forward again to take it out, you just undid the turn. So very important that you put it in the hole and then push all the way back and then come out just like this. I always tell the patient, if you can you hold the appliance, the actual model for me, please? And let me just unscrew it real quick because it's not fitting in the model because I tightened it. All right, perfect. Can you hold it? I'm never gonna have to actually hold the patient's mouth, so the patient holds its own mouth. So I show the parent like this. You literally put the key, it's facing straight right now. You put the key in the hole and turn it all the way back, and then take your 2 fingers right here and hold this part, push back and out. And the reason that you're holding this part with your fingers, what is this? A fulcrum, right? Because this part is sharp and it will hurt the patient. If the parent pulls back and out fast, it can scratch the patient. So I always tell the parent, just undoing it so I can do it again. I always tell the parent to put it in the hole, put the key in the hole, it's straight, put the key in the hole, push it all the way back until you see the next hole. Then with your 2 fingers, grab the actual key and push back and out. So that's what I tell the patient, all right? And sometimes I unscrew it and I let the patient try. The parent try, excuse me. The parent try on the patient, or the patient's friend try, because sometimes the patient is an adult that needs this appliance and needs the expansion, okay? And the patient comes with a friend, all right? Sometimes the patient can do it by themselves. And if they do it, and I'm talking about adult patients can do it by themselves. All minors must have it done by a parent or guardian, okay? But adult patients sometimes do it on their own, but usually they have a friend do it, or a partner, whoever their spouse or whoever they're living with, okay? A friend, sister, sibling, all that, all right? So, and I have them try it, and I'm always over them, watching them, making sure that they're doing it right, okay? So 12 turns for 12 days means 1 turn a day for 12 days. And we wanna make sure that they know that, and we wanna make sure that we give them the form, the parent, the form that says all that information. And of course, there's plenty of videos that show them how to do this. So, all right.